My name is Anastasia Panteleeva. I am a first-year student of the 5th group of the Faculty of Pediatrics, and I want to raise the topic COVID-19 vaccination, pros and cons. So this is our content. What is the vaccination? Pros and cons of COVID-19 vaccination, comparison of vaccines, statistics, and conclusion. So what is the vaccination? Vaccination is a simple, safe, and effective way of protecting people against harmful diseases before they come into contact with them. It uses your body's natural defenses to build resistance to specific infections and makes your immune system stronger. Vaccines train your immune system to create antibodies. However, because vaccines contain only killed or weakened forms of germs, like viruses or bacteria, they do not cause a disease or put you at risk of its complications. Build-up of immunity happens after a person is exposed to different kinds of germs. But there is a single method called vaccination that prevents germs from multiplying. Vaccination functions by protecting the immune system brought about by bacteria or germs before the onset of infection. Vaccination grants resistance against diseases. The topic of vaccination is now more relevant than ever because of the development of the COVID-19 vaccine. Opinions differ as to whether is not to be vaccinated. Let's try to understand this issue and consider both the positive aspects of vaccination and the negative ones. It's natural to wonder if brand new vaccines against a novel coronavirus developed at unprecedented speed are effective and safe to take. Let's review some of what we know. Overall effectiveness has been reported in the range of 70% to 95%. That's well above the average effectiveness of the flu vaccine, for example. There are pros for Sputnik V vaccine. Safety. The Sputnik V vaccine, which is given to Russians, has an efficiency of 92% for the first injection and 95% after the second. This is a very high indicator. At the moment, the vaccine is considered safe and effective. It's well tolerated by people. A short cell war. The vaccination doesn't have a long incubation period. According to the volunteers, the cell war begins about 10 hours after vaccination and lasts up to a day and a half. After that, the normal state of the body is restored. There are pros for the Pfizer vaccines. A large study on the Pfizer vaccine involving about 1.2 million people in Israel supports the finding of clinical trials. It indicates that 2 doses of vaccines reduce symptomatic cases of COVID-19 by 94% across all age groups after 7 days of receiving the second dose. The vaccine also reduces severe illness by 92%. Also, a short cell war. There are cons for the Sputnik V and the Pfizer vaccine. Test mode, no 100% protection. Vaccination doesn't protect a person from the penetration of the virus completely, but only prevents a severe form of the disease and a possibly fatal outcome. Revaccination. The second vaccination should be done 2 to 3 weeks after the first injection. In most vaccinated people, protection is developed only by the 42nd days after vaccination. The most difficult thing is to survive this entire period without getting sick. Deterioration of health. The post-injection period of vaccination, also short, is still there. Possibly pain at the injection site, flu-like symptoms, and aches the next day. What else should we know about possible effects? Severe allergic reactions. Rarely, a potentially life-threatening reaction called anaphylaxis may occur, most often in people known to have had severe vaccines reaction in the past. The first signs are trouble breathing, throat, and low blood pressure. It usually occurs soon after vaccination. Unexplained death. A recent report of 23 deaths among elderly vaccines recipients in Norway raised understandable safety concerns about the new COVID-19 vaccines. However, further investigation is needed to determine wherever these deaths were related to the vaccines or represent an expected number of deaths among frail individuals who already may have had a limited life expectancy. However, in large clinical trials, most side effects have been minor. When side effects occur, they typically last just a few days. A side effect or reaction isn't necessarily all bad, by the way. It may indicate that the body is building protection against the virus. So this is our statistics. Of all 15 countries survived, the United Kingdom shows the highest level of vaccination intent, the lowest in Russia. How we can see. Based on statistics, we can conclude that after all, most people are afraid of the side effects of the vaccine and refrain from using it. So now there is no reason to believe that the coronavirus vaccine can be dangerous. Theoretically, it can cause an undesirable reaction by the probability of this small. So far, we know COVID-19 is an unpredictable and potentially deadly disease, and the information we have about the effectiveness and safety of COVID-19 vaccine is encouraging. Minor side effects should be expected. Severe allergic reaction may rarely occur. Side effects from the vaccine are not reasons for most people to avoid vaccination. The COVID-19 vaccines produce protection against the disease. Developing immunity through vaccination means there is a reduced risk of developing the illness and its consequences. This immunity helps you fight the virus if exposed. Getting vaccinated may also protect people around you, because if you are protected from getting infected and from disease, you are less likely to infect someone else. This is particularly important to protect people at increased risk from severe illness from COVID-19, such as healthcare providers, elderly adults, and people with other medical conditions. Thanks for your attention.